Good morning, guys. This is Dr. Welsh from Indianapolis Sport and Spine. I'd like to thank you for tuning in again this week. Today we're going to be talking about one of the common misdiagnosed or misunderstood conditions that we see in practice and that's out there with everyday activities, and that is carpal tunnel syndrome. And carpal tunnel can present in many different cases, many different symptoms, ranging from numbness, tingling, pain, the pins and needles feeling that you get sometimes. And that's what lends a lot of confusion to what actually causes and what is described or defined as carpal tunnel syndrome. Now, for sake of visual aid, we'll use my hand, okay? And by definition, carpal tunnel syndrome deals with something called the median nerve, okay? The median nerve is going to come through a little groove right here in the palmar side of your hand, okay? And it's right through that little groove known as the carpal tunnel. Okay, the carpal tunnel actually houses arteries, nerves, and veins, all going up to supply this area of the hand. Okay, as far as function, the median nerve is going to control the thumb, the first, second, and 1/2 of that ring finger. Okay, so anytime you're looking at a distribution in this area, in any sort of pattern, it's probably going to be the median nerve. Okay, the problem is when we look at this and we go in and we say, there's some kind of entrapment, there's something going on in this area with the median nerve. A lot of times that's a very short-sighted viewpoint because what happens is we tend to forget the median nerve tracks all the way down through the forearm. Okay, and what happens is through a lot of times through using a computer a lot, through manual labor, through repeated actions, what happens, we can tend to tighten these muscles up. We develop fascial or muscular adhesions and even in some cases scar tissue from injuries. And at any point along this way, that median nerve can get entrapped, entangled, can have issues dealing with it. So if we zoom in again and we look through here, if I'm going to go in to this area and address what I'm considering carpal tunnel, but the problem is back here, this isn't going to do the trick for me. Okay. So first off, we have to make sure that what we're dealing with is a true carpal tunnel. And from my experience and from a lot of the research out there, we know that what most people present with is not a true impingement in this area. Instead, it's going to be addressing something in this forearm area or even up through the elbow area, dealing with restriction in joint motion or even in the muscular and fascial movement. So we addressed a little bit about how to find out what exactly you're dealing with. If you go into a typical doctor's office, what they're going to start you off with is an EMG or some kind of neuroconductivity test, okay? And they're going to use a conduction test to see how fast that signal will fire down the nerve tissue. Some research studies have shown this has a false positive rate of up to 50%, so you want to take that with a grain of salt, okay? Even if you have some conductivity issues, the issue may not be located in that carpal tunnel, in the true carpal tunnel syndrome. So that's addressing more of a carpal tunnel. Remember, okay, median nerve is basically coming right through this portion of the forearm up into the hand and addresses the thumb, first, second, and inside half of that ring finger. Okay, if you're dealing with anything with the ring finger or with the pinky or that other lateral edge of the ring finger, or even down the side of your hand or the back of your hand, you're looking at some other nerve distribution, whether that's going to be, it can be the ulnar nerve, it can be a different nerve entrapment. It may not even be an entrapment at all, a true entrapment. It may be something completely different, and you need to have that addressed. Make sure whoever's treating you is addressing all these issues and talking about the options with you, okay? So that's going to wrap it up for right now. If you have questions, feel free to leave something in the comments section down below and be happy to answer those as they come in. Next week we are going to be talking about the potential treatments for it. Surgery is a ditch effort, it's a last effort, and should be treated as such. There's a lot of conservative techniques out there that we can go through. We're going to demonstrate some of those so you can get a little better feel of what your options are if you are dealing with this carpal tunnel syndrome. All right? So, like I said, any questions, comments, feel free to leave them in the comments section. And again, I'm Dr. Welsh with Indianapolis Sport and Spine, and we will see you soon.